Cardiac disorders in pediatrics. We have looked at left to right shunts and right to left shunts. Now we will be looking at common mixing, often presenting blue and breathless. Common mixing condition, this includes AVSD, complete AVSDs, and complex congenital heart disease, for example, tricuspid atresia. First, we'll be looking at the complete AVSDs, complete atrioventricular septal defect. This is most commonly seen in children with Down syndrome. A complete AVSD is a defect in the middle of the heart with a single 5-leaflet valve between the atria and ventricles, which stretches across the entire atrioventricular junction and tends to leak. As there is a large defect, that there is pulmonary hypertension. Features of a complete AVSD are: number 1, presentation on antenatal ultrasound screening. Number 2, cyanosis at birth or heart failure at 2 weeks to 3 weeks of life. Number 3, no murmur is heard, the lesion being detected on routine echocardiography screening in a newborn baby with Down syndrome. Number 4, there is always a superior axis on the ECG. And number 5, management is to treat heart failure medically, as for a large VSD, and surgical repair at 3 months to 6 months of age. Complex congenital heart disease. So we're done with AVSDs. Now we'll be looking at complex congenital heart disease. It is difficult to generalize about these conditions. The conditions include tricuspid atresia, mitral atresia, double inlet left ventricle, common arterial trunk, also known as truncus arteriosus, because their main presenting feature depends on whether cyanosis or heart failure is more predominant. Tricuspid atresia is the most common complex congenital heart disease. So now I'll be looking at tricuspid atresia, which is the most common complex congenital heart disease. In tricuspid atresia, only the left ventricle is effective, the right being small and non-functional. Clinical features of tricuspid atresia. There is common mixing of systemic and pulmonary venous return in the left atrium. Presentation is with cyanosis in the newborn period if duct dependent, or the child may be well at birth and become cyanosed or breathless. Management of tricuspid atresia. Early palliation, as with all the common mixing complex diseases, is performed to maintain a secure supply of blood to the lungs at low pressure by: number 1, a Blalock Taussig shunt insertion between the subclavian and pulmonary arteries in children who are severely cyanosed. Number 2, a pulmonary artery bending operation to reduce pulmonary blood flow if breathless. Completely corrective surgery is not possible with most, as there is often only one effective functioning ventricle. Palliation is performed. Gland or hemifontan operation connecting the superior vena cava to the pulmonary artery after 6 months of age, and a Fontan operation to also connect the inferior vena cava to the pulmonary artery at 3 to 5 years of age. Thus, the left ventricle drives blood around the body, and systemic venous pressure supplies blood to the lungs. The Fontan operation results in a less than ideal functional outcome but has the advantages of relieving cyanosis and removing the long-term volume load on the single functional ventricle.